All right. So it says we're recording, and guest is Jerica. So I'll remember that if I watch this video again. Okay. So, oh, by the way, I updated today's lecture notes. If you downloaded them before class, I updated them probably right at 11:30. So you might want to get that update. It's not a big difference, but I fixed a couple spellings and I added a diagram that wasn't there. So, all right. So we already went over chapter 8. We're going to go over chapter 9 today, which is producing data with experiments. Okay. So now there are two types of studies that we're going to talk about. We're going to talk about observational studies and experiments. We're going to focus more on experiments today, but I do want to introduce you to the idea of an observational study really quickly. Just like it sounds, you observe individuals and measure their responses, but you don't attempt to influence. So sometimes this is the only way to conduct studies due to ethical reasons. Okay, so remember, we don't attempt to influence. Okay, that's the main thing with observational studies. With experiments, we deliberately attempt to influence. We deliberately impose some sort of a treatment on individuals in order to observe a response. So there was a Danish study done, and it was of 420,000 cell phone users between 1982 and 1995. They compared the rate of brain tumors in people with. I need to rephrase it. Even though I fixed it, I'm going to make changes. In people with and without cell phones, and found no difference between the groups. So the question is this an experimental, is it an experiment or an observational study? And I'm going to do a poll. Here's our first poll question of the day. And it is it an observational study or is it an experiment? And we've only got, I think, 9 people here, if I remember right. Oh, we got up to 10. Okay, so hopefully we'll get 10 answers here. So just give me a thumbs up on either one of those, and I'll let you look at it if you want to and tell me whether you think that's an experiment or an observational study. Whoops, what happened there? Okay, so we've got 3 votes so far. Am I getting another chat? Because I'm getting a bunch of stuff. This is... Okay. All right, so who haven't we heard from? Let's see, we've heard from Lindsay, Morgan, Shannon, Cheyenne, and Jerica. So Cody, what do you think? Are you here? Is that why you're off camera so that you cannot pay attention? Or Lindsay, you missed the question? So the question is, you have to decide whether this is an experiment or an observational study. Danish study kept track of 420,000 cell phone users between 82 and 95. They compared the rate of brain tumors in people with and without cell phones, found no differences. Is this an observational study or an experiment? Okay, and if you can use the thumbs up, it makes it a little easier for me to keep track. So 6, 7, 8. Who's missing? All right. Okay. Cool. All right. So everybody agrees that's an observational study. That is correct. Okay. It's an observational study because we aren't imposing a treatment. So let's do another example here. Researchers want to know if a certain drug cures the common cold. They divide subjects into two groups. Half are given a new drug, half are given a fake pill. The results are who recovers from the cold. Is this an experiment or an observational study? So we'll do this again. Is this an observational study or an experiment? So give me a thumbs up on whichever one of those you think is correct. Oh, this is funny. My last class didn't pop in all these things. They just answered. That's weird. I wonder why it's doing that. Oh, this is really weird why it's doing this. Okay, so we've got 5, 6. Well, it looks like we have 5. Okay, how come you guys aren't voting?
It like won't let me go to the conversation and vote
if you're a
for some
guest,
reason.
If you're a guest, yeah, you can't. And I also wonder if it's because, do you have, Morgan, have you downloaded Microsoft Teams?
Mm-hmm. Yeah, I'm on it. I don't know why it's not. I've been able to before. Oh, there we go. Okay, it worked.
I'll let you that time. Okay, perfect. All right, so we all agree that that's an experiment. That is correct. Okay, so perfect. That's an experiment. We're imposing a treatment. All right, so experiments are often preferred by scientists because they usually suffer less from lurking variables and confounding. We talked about that last time. On the other hand, sometimes experiments aren't representative of the real world and are done on dream patients, making the results biased. Okay, experiments can't be always done for ethical reasons too. Observational studies are used because you can't always do an experiment for ethical reasons. So for example, I can't force you guys to smoke. I can't force you to go to church. I can't, I can't force you to have an abortion or something like that. And so, anyway, there's some really fantastic podcasts that discuss, while I do say experiments are usually preferred, they do have some problems. So there's some really, really interesting podcasts. My 3 favorite podcasts I'm going to talk about. Number 1 is Freakonomics. It's fantastic. He's always talking about statistics and usually economics. Another great one is called The Hidden Brain, or The Hidden Brian. That's funny. I never noticed that before. The Hidden Brain. And 538.com has to be, it's my favorite one. They usually talk, well, they talk about sports, but I actually prefer their politics. And so experiments are usually better, but Freakonomics has, these are all Freakonomics ones below, that has some really good things that talks about bad medicine and how there are experiments that are done that have problems, okay? There's also a very interesting one. We talk about placebos. Did we talk about that last time? I don't remember. But placebos, the idea is with the placebo effect, sometimes people can get better if they think they're getting a drug. So for example, there was a study done and it was on bald men, basically. I guess women can go bald too, but it's usually men. So, and so they gave half of the group a placebo, just a sugar pill. And here's the weird thing. 40% of the men that were bald grew hair. Now, how does that happen? I don't know. Your mind does weird things when you think you're getting a treatment. And so the placebo effect can have some amazing things. Now, this one on the hidden brain talks about using placebos to cure people. You've probably heard of being mesmerized, right? Have you heard of being mesmerized? No? So there was a guy named Alfred Mesmer. His last name was Mesmer. And basically he would dress up and he would do all these weird, wacky things. And they said that when you were done with him, you were mesmerized by him, and that's where the word kind of comes from. And he would cure people. And I think it was Benjamin Franklin went and said, "Oh, this is all crap." But at any rate, what they've done some studies, and they've said that that if you as a doctor put on the air that you're curing somebody, you can actually cure somebody with just the placebo effect. So it's really, really an interesting podcast. All right, so here's an example of a good experiment. Let's take a group of rats. We're going to divide them into 3 groups. The first group gets analog cell phone radiation 4 hours a day, 5 days a week for 2 years. The second one's going to get digital. So the difference between these, one's analog, one's digital. They get them for the same period. The third group gets the placebo group. They get no radiation. So the cancer rates would be compared, and in this case, no link was found. So I don't know if you remember, but probably 10 years ago, there was a big question on whether cell phones cause brain cancer. One of the things that the companies have done is they've now put insulation in your cell phone so that you get less insulation. So that could be one of the reasons why we have less cancer now than maybe they used to. All right, so confounding, okay? Confounding means the effect of 2 or more variables are not separated. I think, well, let me just, I can't remember did I talk about smoking or sugar causing heart disease last time in class? I can't remember. Okay, so back in the 1970s, there was a study done, and it said that sugar caused heart disease, okay? And so there was another study done, and it said sugar has nothing to do with heart disease. So a lot of times when I think of confounding, you think of conflicting studies. And so, so the question is, why do these studies conflict? Why is one study say sugar causes heart disease, the other one doesn't? Well, in the case of this study, what happened was the original researchers did not take into account whether people, oh, somebody left. Okay, hopefully they can come back in. Whether people were smokers or not. So did you guys know that smokers consume more sugar than non-smokers? Who knew that? Okay, how'd you know that, Lindsay? You're still on mute. Are you a nursing major? Somebody? Did you write? Okay. So yeah, so here's the weird thing. Back in the 1970s, there was no Starbucks. And so everybody had to taste black coffee. And I'm not a coffee drinker, but from what I understand, black coffee tastes terrible. And so you have to put sugar in it. And that's why Starbucks is so famous, because they put lots of good flavors in their coffee. But so back in the 70s, a person would smoke, they'd sit down with their cup of coffee, and smoking kills your taste buds. And so in order to taste the sugar, you got to pour a bunch of sugar in there. And so it turned out that smoking was the real cause of heart disease. It wasn't sugar. But so what we had confounding. The effects of 2 or more variables were not separated. So I've mentioned all that. So anyway, when smoking was taken into consideration, the effect of sugar vanished in relation to heart disease. And it turns out that smoking was the cause of heart disease. It wasn't sugar. And so smoking is what we call a lurking variable. So a lurking variable is something that was not considered in the original study. So because the original study did not include smoking was the lurking variable. So confounding and lurking variables always go together, okay? When you have confounding, it's because you have some lurking variable in case. So those always kind of go together. Yeah, so any questions on confounding or, the other definition I like to use for lurking variable is what you forgot to include in your study. Okay, because usually it's something you didn't think about, because most people wouldn't remember that, wouldn't think that smokers would have more sugar. Just, I mean, it makes sense after you explain it, but it's not something that you would think commonly. So any questions on confounding or lurking variables? Okay. Is that a cappuccino you got there, Morgan, or something else?
It's a pumpkin cold brew.
Cold brew. So that's your coffee.
Yeah.
See, aren't you
That's my
glad
coffee.
you didn't grow up in the 70s and everything was black?
Yeah, no, couldn't handle it. This is all like pumpkin foam right here.
Yeah.
It's perfect.
It's going to rot your teeth and cause you to get diabetes, but it won't cause you to have heart disease. All right. So anyway.
Can I ask a quick question?
Yeah, go ahead.
What's the difference between a lurking variable and a confounding variable? Like, if you were to say, just like.
There's no such thing as a confounding variable.
Okay. All right. Yeah.
So it's a lurking variable and like I said, it's a variable you didn't include in your original study that causes confounding. So in this case, confounding is you have the effects of two or more variables are not separated. So in this case, smoking and sugar were conflated together, okay? And they erroneously thought that it was sugar that caused the heart disease, but it was really the smoking, because they didn't distinguish smoking from sugar. Does that make sense?
Thank you.
Okay, perfect. All right. Now we're going to talk about observational study types. Okay, we've got cross-sectional studies. Okay. The idea with a cross-sectional study is you're going to collect information over a short period of time. For example, you can compare the incidence of lung cancer between smokers and non-smokers. Now, whenever we talk about a cross-sectional study, so for example, I could go through and I could do a cross-sectional study right now, and I could say, how many of you have cancer? Hopefully everybody says no, and then that's great. And so I did that over a very short period of time. Now, short period of time can be a day, a week, a month, even a year. You're just collecting information over a short period of time. And so the problem is, so we'll go back to my example, how many of you have cancer? Everybody says no, hopefully. And then I write my study and I say, nobody has cancer in my class. And then tomorrow you go to the doctor and they break the bad news that you've got cancer. So the problem is with a cross-sectional study, because you collected it over a short period of time, you probably did have cancer today, you just didn't know it. And so you will miss cancers that occur. But the benefit is cross-sectional studies are easy to do, they're usually inexpensive, and they're fast. So that's one type of observational study. Another type that we have is what's called a case control study. Okay, case control studies are retrospective, and retrospective means to look back in time, to look for different characteristics. So these are often used in rare cancers studies. So the idea is we try to look for difference between the cases of cancer and the controls. So you try to match people based on different characteristics, such as age, income, race, whether they smoke, etc. And so the idea here is you've got, let's say you have twins. I mean, that would be ideal. So you've got twins, one has cancer, one does not have cancer, and you're trying to say, well, I wonder why this person has cancer. Oh, maybe they smoked, or maybe they worked at a nuclear radiation factory or something. And so so the idea is you take two people, one of them has the cancer, one of them doesn't. You look back in time and you try to say, what are the differences between these two people? What might have caused the cancer? So the problem is people often have poor memory. They might not tell you the truth. Maybe they were using drugs and maybe that's what led to the cancer or something like that. But that's another type of study, which is a case control study where you're looking back in time. Okay. Another thing is called a cohort study, which is, maybe I should add in here, prospective. Prospective. which means instead of looking back in time, you follow a group over time, so prospective, okay? Some of these studies can last decades. Oh, I did write prospective, I didn't see it there. And so the nice thing about this is you have better data collection, but it can be very expensive to track over time, okay? And so there's a famous study called the Framingham Physician Study. It's been going on for 40 years. And basically, some researchers in Framingham, Massachusetts, took a bunch of doctors, and they wanted to know, wanted to follow them over time and see what diseases they would get. And so they've been following for like 40 years. It's been a really long time. And sometimes they would even do experiments with these cohort studies. And so I had one of my professors up at University of Utah was part of this Framingham physician study, and he said sometimes they would send him pills in the mail and they'd say, take this. You know, probably not a good idea for most people. Here, take this pill. I don't know what it is. But he said he followed it, and one time he said the pill kind of dissolved in his mouth before he could swallow it, and he tasted it and he goes, I think that's aspirin. And it was. And so, and it was a result of that Framingham physician study that they made the recommendation that people who take an aspirin a day, you know, usually like a little baby aspirin, have lower heart disease and cardiovascular problems. And so that was from the Framingham physician study, which was a cohort study. And so these are probably, of the three, these are the best to do, but because of that, they're also the most expensive to do. And so, so those are your three types of observational studies. So any questions? Where in the textbook can this be found? It should be found in chapter 9. Okay, and I'm also going to post my notes as well. Now, some people are biased against observational studies, but sometimes these are the only ethical ways to study certain things. So we're going to talk now about experimental design. Okay, so a control group serves as a baseline treatment that can be used to compare other treatments. Okay, so blinding refers to non-disclosure of a treatment that a subject is receiving. So there are two types of blinding: single blinding and double blinding. With single blinding, the subject does not know if they are receiving the drug or the placebo. With double blinding, both the patient and the doctor don't know. So the reason why is sometimes a doctor may have bias in treating only those who he thinks will benefit. And so double blinding helps alleviate that problem. So just to show you kind of the an example, there was a study done, I think it was done up in Canada, and this doctor wanted to know if he was treating prostate cancer, and he wanted to know if surgery or if drugs were a better treatment. But the problem was, because he did a single blind experiment, and the problem was he would give all of the young people the surgery because, and there were medical reasons for that, because he felt like they would recover better than, you know, a 90-year-old man is not going to recover from surgery very well. And so he would give the older patients the drug and he would give the younger patients the surgery. And so as a result, his results were biased because he hadn't randomized the treatments, and it looked like surgery was better. And maybe it was, maybe it wasn't, but the problem was we don't know because he didn't randomize those treatments. And so that can be an example. I don't know, I don't think it was necessarily purposeful that he had bias in there, but that can be an example of why a double-blind study is good. Now, one of the problems with blinding is it works really well for drugs. You know, here's a pill, take it. We don't know what's in the pill. It doesn't work so well for diets. Like, how do you, I'm going to put you on a vegan diet and I'm going to put somebody else on a meat eater diet. You can tell that you're eating meat or not meat, right? And so it's really hard to do a placebo diet. How do you pretend, you know, force people to have vegetables? Okay, it doesn't work very well. Also in the past, in fact, we talk about this in some of those podcasts that I mentioned earlier. They've been doing some studies about surgery. It's hard to do placebo surgery. In the past, they would avoid it because the problem is if you cut somebody open and then just sew them back up, you can actually introduce an infection. But they've actually started to do some placebo surgeries. Basically, there was a study done, and they were taking some people that had arthritis in their knees, and some people would get arthroscopic surgery. Some people would instead of arthroscopic surgery, they would just flush out their surgery with saline, and sometimes they would just cut them and pretend they did the surgery and then sew them back up. And one of the things that they found, and this relates to the placebo effect, is that all three groups felt like their knees were better. I think they might have had a fourth group where they did no surgery. And so it's amazing that sometimes if you think you're getting a treatment, that it makes you feel better, even though it doesn't do any difference, any good. So now let's do another example here. We're going to test you guys and see if you can do this. Okay, so I've got the example here. Placebo-controlled double-blind study was designed to see if Lipitor presents cardiovascular disease. 2,838 subjects participated. They were aged 40 to 75 with type 2 diabetes and had no history of cardiovascular disease. Subjects either took 10 milligrams of Lipitor, of which there were 1,479 subjects, or the placebo, there were 1,411 subjects. The response variable was a cardiac event. So let's pick on Cheyenne. I was going to pick on Terrelyn, but I won't. But Cheyenne, that doesn't mean you're off the hook. Next time are you gonna have a microphone next time? Hopefully. Just nod your head and say yes. Yes. Okay. Good. So Terrelyn. Okay. Good. Not Terrelyn. Shannon. Who did I say? Cheyenne. We're gonna go with Cheyenne. Cheyenne, what do you think is the population in this example?
The people ages 40 to 75 with type 2 diabetes.
Oh, well done. And no cardiac history of heart disease. Okay. Now, I want you to know I've given this same example in all three of my classes. You were the first one to get that right. So pat on the back there. Okay. So most people in my other classes put in the 2838, but what is the 2838, Shannon? Oh, Shannon's off. Are you there, Shannon? Are you ignoring us? It is the statistic. Okay. No, it's not a statistic, actually. It was a good guess, though. How about Morgan? Can you tell us what the 2838 is?
I was getting my laptop charger when you were explaining the problem.
Oh.
So I didn't exactly hear what we were talking about, and I knew you were going to pick me, but
Okay.
if you explain it, I'll give it a try.
Here, we'll go to Lindsay and we'll come back to you. Okay. How about Lindsay? Can you tell us what the 2838 is in this example?
What was the context?
Okay, so it's right here. Placebo-controlled double-blind study to see if Lipitor prevents cardiovascular disease. 2838 subjects participated, aged 40 to 75, with no history of cardiovascular disease, and they either took Lipitor or placebo.
It's the sample, right?
So that is the sample, correct? And Morgan, you knew that too, right? Now that I explained it. Okay. Part of the reason we're keeping you here is we want to keep you on your toes and you're not going, oh, that teacher's so boring. So I may be boring, but I'm going to pick on you. Okay. Hopefully that'll keep you from being bored. All right. So Now, this brings up another issue, okay? And the issue is, why do you think that these, ideally, we'd love these two groups to be exactly the same. Am I not sharing my screen? Yes, I am sharing my screen. Oh, I thought I was. It says I'm sharing it. Let's try it again. Oh, okay. Well, thanks. You should let me know sooner that you can't see my screen. I thought you could see that. Okay, so ideally, we want those to be the same. But why do you think that these are not the same? Do you have any ideas? The answer was on the screen, but I hid it really quickly. How about Jada? Any ideas, Jada? Jada's looking away. Are you listening to me? Jada's not listening to me. Can you hear me, Jada? All right. Anybody else? How about guest, which would be Jerica? You're on mute.
Probably circumstance, something they had to, let's say they didn't have an even number of participants or something.
Yeah. Now these are actually pretty close in size. They could actually, just by random, I mean, those are pretty close to the same size. But one of the problems is a lot of people drop out if they think that the drug is, that if they don't think the drug is helping. If they think they're getting a placebo, your placebo groups almost always are smaller than your drug groups, because people are like, this is a placebo, it's not helping. So it's just something that we're going to have to deal with. Sometimes you can try to make your placebo group a little bigger so that you know that if you have dropouts, it'll still be pretty close to the same size. But that's just one of the things that we have to do. So, all right, let's talk about steps to design an experiment. Now, the first thing you need to do is identify the problem. We need to be explicit. We don't want to say, hey, I want to see improvement, because that is vague. How do you know if improvement is made? So let me give you an example here. And this is a true story that happened to me. And so I was working up at the University of Utah. I had a physician come up to me and she said she wanted to design an experiment, or to design a study. And she wanted to see if people improved their habits with relation to skin cancer. Okay. So I said, that sounds like a great idea. How do you measure that? And so I'm going to throw this at you. You're the physician. How would you measure how somebody is improving their habits with regards to skin cancer?
I think first you'd have to define what habits you're looking at. Like, are you looking at putting on sunscreen or wearing protective clothes like hats or whatnot? And you could measure that, but I don't think you could just measure habits.
Okay, you're on the right track. Okay, so so the question is, in fact, this happened in my other couple of classes. So in fact, somebody says, well, yeah, you can see if people are putting on sunscreen, right? And my question was, okay, are you going to follow people around and note if they're measuring sunscreen? How many of you think that's a practical idea? Probably not. Maybe you could get a bunch of students. You've got a lot of money. You've got money to burn. You'll hire a bunch of students to be stalkers and say, hey, follow these people around and see if they're putting on sunscreen. Okay, or they're wearing hats or that sort of a thing. So that's not very practical. So what is, let me throw it out to Christopher. What would be a good idea, or do you have any good ideas? And by the way, you're wearing a hat, so I'm glad you're keeping the sun off your head. That's good. That's you're being safe there. But what would be some good ideas to measure that people are improving their habits with regards to skin cancer? Can you repeat the first part of the question? So the doctor wants to see improvement with regards to skin cancer. How could you design an experiment to do that?
Wants to see improvements.
Because improvement's just kind of vague, right? How would you measure that?
You'd have to, I guess, survey the patients periodically to determine if they're getting better or not.
Okay, survey, that's a good idea, okay? That would be a lot better than following the people around and seeing if they're putting on sunscreen, right? So that's, yeah, that would be more practical. Now, the problem is, what's the problem with the survey?
Are you asking me?
I'm asking anybody, but you can answer.
People lie.
People lie. They're going to tell you that they put on sunscreen when they don't, right? What else? Maybe they don't lie, they just forget. Okay? So let me explain to you what she decided to do. So she wanted to create a pre-test and a post-test. So basically she would pass out a questionnaire at the beginning. She was teaching a class. She'd pass out a questionnaire. Are you wearing a hat? Are you wearing long sleeve shirts? Are you wearing sunscreen? You know, sunglasses, that sort of a thing. And so, so she'd pass that out. People would answer it. And then she would teach her lesson. And then after she got done, she'd pass out the exact same questions and say, are you going to wear a hat? Are you going to wear long sleeves? Are you going to wear sunscreen? That sort of a thing. And so, so that was how she was able to measure it. So the point is, okay, when you identify the problem, you need to be explicit. You also need to think about this and think about how practical it is to collect the information. It can be very difficult, okay? All right, step number 2, determine the factors or variables that affect the response variable. You should almost always include age and sex among other variables. Usually there are differences by age. Younger people act differently than older people. Men act differently than women, and that sort of a thing. All right, determine the sample size. We're going to talk about sample size calculations later. Determine the level for each factor. Now, another example, I'll probably give you an example about growing plants, is maybe you want to determine if there's different amounts of fertilizer that you want to use and see if more fertilizer isn't always best or better than less, okay? You'll want to control, say, the level of fertilizer, and you want to randomize that. Step number 5, you're going to conduct the experiment. You'll randomly assign subjects to the treatment groups, and you'll collect and process the data. Step number 6 is to test the claim. There are 2 main ways we're going to test the claim, and that's with confidence intervals and hypothesis tests. So I'm not trying to scare you, but when we get to confidence intervals and hypothesis tests, that is your indication that the class just got hard. I always tell people the first 2 tests are really, I won't say they're really easy. They're not, but the last 2 tests are really hard, okay? And I don't want to say they're easy because then you'll be like, oh, I don't have to study. They're going to be hard. All 4 tests are going to be hard, but the last 2 are going to be really hard, okay? So don't forget to study. All right, so let's talk about a completely randomized design. Oh, I thought I had a drink here. Okay, completely randomized design is one in which the experimental unit is randomly assigned to the treatment. So let's talk about a farmer wishes to determine the optimal level of fertilizer in his soybean crop, design an experiment that will assist him. So we're going to follow these steps for doing the experiment. Number 1, the farmer wants to identify the optimal level of fertilizer for growing soybeans. We define the optimal as the level that maximizes yield, so the most beans, okay? So the response variable will be the crop yield, okay? So some factors that affect crop yield are fertilizer, precipitation, sunlight, method of tilling the soil, type of the soil, plant, and temperature. So in this experiment, we're going to have 60 soybean plants, and we're going to list the levels. Now, Obviously, fertilizer is just one of the many factors or variables that we could use. So in this case, he's going to vary the fertilizer. 20 soybean plants are going to have no fertilizer. 20 are going to have 2 teaspoons of fertilizer per gallon of water. And 20 are going to have 4 teaspoons of fertilizer per gallon of water. Okay. So, so there's other things that, of course, cause plant growth. Precipitation. Now, if we're in a greenhouse, we can actually control the amount of water, but if it's outside, we can't really control the amount of rainfall, but we can try to control the amount of watering we do so that each plant gets the same amount of precipitation. So some of these are harder to control than others. Sunlight, once again, if it's outside, we can't really control that, but we're going to try. If we do a greenhouse, maybe we could. If we could do that. But hopefully we're not planting some plants next to a big shade fence or something, and so they'll each have the same amount of sun for each plant. Method of tilling, we can control this factor. Maybe we'll use some Roundup to get everything ready. The type of soil, that can be another factor. And we're gonna assume that all of the plants are in the same types of soil. Plants are going to vary from plant to plant, and so we're going to randomly assign this. And then, of course, temperature. If we put it at the greenhouse, we can control the temperature. If it's outside, it's not controllable, but theoretically, it should be the same for every plant. Okay. Step 5 is we're going to assign each plant to a treatment group. So maybe we'll number the plants from 1 to 60 and then generate 20 numbers, and then we will pick those for treatment A. Then we'll renumber them from 1 to 40 and generate 20 new numbers, and those will go to treatment B, and the remaining plants will get treatment C, and we'll till and fertilize everything the same. So then we'll determine the differences in yield among the 3 treatment groups. So the main thing, I'll probably ask you on the test to come up with a diagram that looks something like this. So the idea here is we're talking about a completely randomized design, and the first thing that you're going to do, and this is something that students often forget, is you're going to make a random assignment of plants. So don't forget the word random, okay? We're going to randomly assign it to the plant to one of 3 different groups. Group number 1 is going to get treatment A, group number 2 is going to get treatment B, group number 3 is going to get treatment C, and then we will compare the yield among those 3 groups. So this is the sort of thing that I'll probably have on a test where I'll say, okay, I want you to design an experiment that is a completely randomized design, and theoretically you'll all come up with a diagram that looks something like this. So do you have any questions on the completely randomized design? Okay. All right, now we're going to talk about a different type of experiment, which is called a matched pairs design. Okay. This is an experimental design in which the subjects are paired up. So the pairs are selected so that they are related in some way. Now, one of the easiest matched pairs design is to pick the same person and measure them twice, maybe a before and after. So this is kind of like when I talked about the professor that wanted to improve habits with regards to exposure to the sun. Okay, so she gave a before, a pre-test and a post-test, and the treatment was the class in that case. And so a matched pair could be the same person just measured twice. Twin studies, those are fun to see how the twin studies work. A lot of times twin studies are nice because, especially if they're identical twins, they have identical DNA, and so you can rule out DNA as a difference. And another type of matched pairs design would be a husband and wife. Maybe you could compare the husbands versus the wives and see what the differences are. And so we could do the same geographical location and so forth. So now one of the differences with the matched pairs design is you're limited only to 2 levels of treatment, whereas with the completely randomized, you can have more than 2, 3 or 4 or 5 or 6. Usually you don't want to get too complicated there, but yeah, you can have more levels of treatment. So in a matched pairs design, one matched individual will receive one treatment and the other receives a different treatment. So the matched pair is randomly assigned the treatment using a coin flip or a random number generator. We then look at the difference between the results in each matched pair. One common type of matched pair is to measure the response variable in an experimental before and after. So I talked about that with the skin cancer example. In this case, the individual is matched against itself. These experiments are called pre-test, post-test, or before-after experiments. Okay, so here's an example of a matched pairs design. So an educational psychologist wants to determine whether listening to music has an effect on a student's ability to learn. So we can design an experiment to help the psychologist answer this question. So we're going to use a matched pairs design by matching students with the same IQ and gender, just in case gender plays a role. A lot of times men and women react differently. So, so maybe we'll match students according to IQ and gender. So we'll match 2 females that have IQs 110 to 150.
You muted your mic. We can't hear you.
Thank you. I don't know how that happened. I must have pressed a keystroke and I didn't know about that. Was my mic off for a long time? Okay. I don't know how that happened. There must be a keystroke I don't know about. I'll just start again with the education.
It just happened again.
That's bizarre. That never has happened before. Okay, well, thank you for speaking up. Okay, so we're going to use a matched pairs design for matching IQ and gender. So we'll match IQ and gender. So for example, we'll take 2 females, maybe they're both 24 years old and they both have IQ 110 to 115. And for each pair, we're going to flip a coin to determine whether they get the quiet room or the music in the background. And so each student will be given a statistics test book and asked to study a section. After 2 hours, they'll enter a testing center and take a short quiz on the material in the section. We can compute the difference in scores for each matched pair. Any differences would then be attributed to the treatment. So, all right, so before, when we were talking about completely randomized design, I told you I wanted to see a diagram that looks like this. With a matched pairs design, I'd like to see something that looks like this. Now, a couple things I want to point out for differences. Remember, with the completely randomized design, randomization comes as your first step. So don't forget that randomization step. That's your first step. Whereas with the matched pair, it's actually the second step. The first step we're going to do is we're going to match students based according to gender and IQ. And then at that point, we're going to randomize each person to one of 2 treatments. We'll administer the treatment to each matched pair, and then we're going to compute a difference, okay, on the scores of the exam, okay? Now, the one thing I just want to emphasize is as we're doing this, the type of experiment you do, okay? In this class, I'm probably going to teach you guys about 6 or 7 different ways to do a statistical experiment. And I'm going to ask you guys, you're going to have to choose based on the experimental design. If it's a matched pair, you're going to do one technique. If it's a completely randomized design, you're going to do a different technique, okay? And so it's important to make sure, this is kind of a foundation for the rest of the class. make sure that you understand the type of experiment, because that's going to affect the type of statistical test you can do. Now, let's talk a little bit about simple random sampling. It is often the case that experimental units are selected to participate are not randomly selected. So for example, the example I gave about the Lipitor, oh, that was back a long time. Okay, so we're looking for people that have these characteristics, and these characteristics are not random. But we want to make a cure for diabetes, so we're going to have to look for people who have diabetes. So clearly that's not random. And we're going to ask them to participate. However, once we have our experimental units in our study, we're going to use random sampling to assign them to treatment groups, okay? So we're still going to use random even though they're not random. So with this random assignment, we assume that the participants are similar at the start of the experiment. Because the treatment is the only difference between the groups, we can say that the treatment caused the observed difference in the response variable, okay? Any questions on matched pairs design? Okay. All right, a third type of experiment is called a randomized block design. So this one's actually very similar to the completely randomized design. You'll notice the names are kind of similar too. But sometimes we're going to divide groups up into blocks or strata, okay? Within each block, the units are randomly assigned to treatments. So you can block on gender, age, or something else. So an example, often men and women react differently to drugs and also to advertising. And because of this, we'll often use a randomized block design where the blocking variable is gender. Now, let me just share with you a horrible story that happened, I don't remember if it was in the 60s or the 70s, but it has really affected a lot of studies. So the problem is, basically they found a drug, and I think it was called thalidomide, and it was a good sleeping aid, and it was also good to prevent nausea. Now women, a lot of times when they get pregnant, get a lot of nausea. And so they said, oh, we've got this great drug, it's called thalidomide, and it will help you with your nausea. Okay, so now I know, I just saw that message, somebody muted me. That was not me that did that. So whoever's doing that, please don't mute me. But at any rate, so with this thalidomide, they would give this drug to these women that were pregnant. It would help with their morning sickness. The problem was it had a horrible side effect in that it caused birth defects, okay? And so, so what happened was a lot of the drug manufacturers said, okay, fine, we don't want to cause birth defects. We're going to eliminate women from all of our drug studies, and we're just going to test these on men because men don't get pregnant, and so they're not going to have that side effect. And so the problem was they've had all these studies where they were only tested on men, they were proven safe and effective on men. Now the question is, okay, we're going to release this to the public, and is it safe for women, especially pregnant women? We don't know. And so a lot of times what they'll do now is we'll use a randomized block design. And a lot of times the blocking variable is gender. It does not have to be gender, but so let's pretend that we're using a randomized block design where the blocking variable is gender. So the first thing is we're going to do is we're going to split into men and into women. Obviously, that's not a random assignment, but once we've got the men, we're going to randomly assign the men to each one of two groups, and we're going to randomly assign the women to one of two groups, okay? We'll give each of them a treatment, and then we will compare our results. So we will compare, so we're comparing the men versus the men, and we're comparing the women versus the women. Now, when you're doing a randomized block design, you shouldn't compare the men to the women because these are not random assignments to gender. And so, so this is very useful, especially when, so drugs is probably the most common place to use a randomized block design, but advertising is another example. I will tell you, my mom and my sister love to watch the Hallmark Channel because it's very romantic. And you know, it is after the first one that you've seen, but then the story, the plot gets repeated over and over, just in a different state or a different setting. And so some women love those. Obviously, my mom and my sister do. I'm much more of a sports guy. Did you guys hear? You guys probably aren't sports fans, but the Jazz game, I worked for the Utah Jazz, and I was supposed to go to the Jazz game immediately after our class today, and it got it got canceled. I guess I've been confirmed, so I'm not going to be able to go. But at any rate, thank you, Jerica, for the tear. Are you a sports fan, Jerica? No? Okay, well, I'm a huge sports fan. But that can be another thing. So advertising, men are going to laugh more at crude jokes. Women, a lot of times, like more sentimental things. Those are just generalizations. So anyway, so that's chapter 9. I have posted the update. So any questions that you guys have for me? We've got about 10 minutes left. I don't want to start on a new thing, but do you guys have any questions for me? I did just remember one other thing that I wanted to bring up with regards to homework. I've gotten a few emails from people and they're like, I did all the homework and it shows that I have 0% in Canvas. And so the updating the grades is a manual process. As long as you do your homework on time, I'll probably update it probably after class. And so I will update that today. I will do it today after class. And so don't worry too much about that. It will get updated, but it's just a manual process and I'll have to do that every time. I don't think I graded your quizzes yet. You probably noticed you got low scores on the quizzes and I will have to manually. That's why multiple choice is nice because I don't have to grade them. But they're sometimes hard to write. So anything else? You guys have any other questions for me? Okay. Well, I'll let you go a few minutes early then. If you want to stick around, you're welcome to. Study groups are all. Okay, somebody just muted me again. That is not me. It's one of you guys. So I don't know who's doing that, but that's why I get muted. So be careful with your keystrokes. Somebody's muting me. So I wonder if I can unmute you. Let's see if I can unmute Chris. No, I don't know. You guys are doing something, but anyway. So I'll let you guys go. And quiz and homework are both due on Tuesday at 11 a.m. before class. Okay. So see you all on Tuesday.